Sounds like we're going to have to build a walking break into our meeting room. I am not going to attempt to summarize the examples and the frameworks that our panelists have laid out for us, but instead turn it to you now to ask questions of this incredible panel. And I want to say thank you again to all the panelists for really some thought-provoking ideas and comments for us to tee up. For those of you who are participating through the webcast, you can submit questions or comments through the webcast window, and we'll try to get to some of those questions. Is there anyone here that would like to start? All right, Winston.
Thank you for a great panel. My name is Winston Wong. I'm a member of the Roundtable on Health Equity and the Elimination of Health Disparities. And I have to say, I was totally enthralled by the presentations this morning, but I thought it was quite noticeable that I don't think any of the speakers actually mentioned the isms. And as I recall, Policy Link has been very active in highlighting the isms, the so-called aspects of how our country lives under the umbrella of racism, elitism, sexism, homophobia, among other things. And I'm not sure whether we're at this crossroads with regards to whether that framing is one that is antiquated and or whether there is an aspect of not being aligned with identifying who the antagonizer is or the agonist is here, or whether there's a political issue with regards to calling out the issues that historically have been what have driven much of the major movements, i.e. putting together the anti-racist movement or the movement against sexism, movement against ageism. I was wondering if any of you could comment about whether this is still part of the dialogue that will help us move forward in terms of creating movements.
I'll be happy to get started. Thank you, Winston. Very keen observation. I was very intentional in my use of language for my 10 minutes. And I wanted to frame everything around equity and have that be an assumption of a broader category that would include, because when we're talking about equity, who's being left out, you can't ignore issues of race and racism. I don't usually talk about racism specifically, but we do talk about issues of race and why those who are in the ones who are suffering the most have to be brought up. So I do think that we have to be careful about our language, not to avoid tough topics, but I think finding a way to make sure that we are embracing it. And it doesn't have to, in my opinion, be as deliberate or as an intentional. Sometimes I do, sometimes I'm not. Today I decided I wasn't going to do it, but it wasn't because of its lack of significance.
I will say that as we've been going around the country with the county health rankings and having those community conversations, this issue around racism, ageism, sexism actually comes up as some of the drivers for why they have the challenges that they have. So it's been really interesting to witness how those community leaders and community members are coming together to have a dialogue that, quite frankly, they hadn't been able to have before because it was so personal and sensitive on both sides. And this was a way for them to come together and say, you know, the challenges that we have around education in our community, we have to deal with some of these issues and find a way to have this conversation. And, you know, I didn't talk specifically about it today, but I think we're seeing more and more that on the local level, people are attending to how their communities were even designed to separate some communities from others and how they can actually change that over time.
Any other panelists want to make a comment? Okay, Sani.
Sandy Magnan from the Institute for Clinical Systems Improvement, Minnesota, part of the Population Health Roundtable. Thank you all for these great examples that give us more food for thought and thinking how we move forward. I was piqued particularly, and I'd like to address to all the panelists, Ray, what you said about 5 things that you found in common about some movements, that there was a clarity of purpose, but then when you particularly set out in your walking movement that articulating a clear set of values and goals. When we often talk about, goals and metrics and how we're going to measure how we're making progress. But this thing about values, and some people have talked about, well, you can't really change values. You just need to make certain you link to people's values. You might be able to change attitudes. You could change information. But talk to me more about your articulating a clear set of values, how you found common values, or maybe you didn't find values. Did you expect to change those? And comments from others. I think this is really important because often we talk about values are immutable. You can't really change those. You could change information, knowledge, beliefs, attitudes, but can you really change values? And I think that's important for us to think about collectively.
Well, just briefly, I think I said what I had to say about I think values are very powerful and motivating, as I think relationships are. And there's great opportunity to build around values and around relationships, even when people's interests are different or may even be opposing. And I think, and I'm not the expert at this, but my sense is often we are working very hard to try to figure out how to find common ground in our interests, when sometimes it can be easier and more empowering to find common ground among our values. What do we care about? What has meaning for us? What drives us? What motivates us? And part of this I learned from my wife, because every time I say to her, Aida, why don't the Republicans understand that business does much better when the Democrats are in office? And she says, because people vote their values, not their interests. And I've thought about that for a long time. People don't always, we act as though people are going to behave according to their interests. And in fact, they more often behave according to their values. So I'm not saying it's a complete answer, but paying a lot of attention to values, both the values of the people that you want to engage and the values that are at the core of what you're trying to achieve, I think is often a bit overlooked in forming movements and in sustaining them.
I would just agree and maybe add a little bit more context. So I think you do look for those shared values, and that's at the root of developing messages that will resonate with multiple audiences. What are the underlying values of the audience that you're looking for? And if you're trying to get those to sum up to a social movement change, there needs to be some congruency and finding the denominator that brings people together. That's why I was fascinated with this concept of fair opportunity and personal choice. That's really important. And I thought about values in the context of the smoking movement in Colorado. So I'm from Colorado. We're a cowboy state. While New Hampshire's motto is live free or die, ours is live free and die. And to wake up in a state after spending my career as an anti-smoking zealot and have a Clean Indoor Air Act pass in the state, I'm just saying, what happened? Did people's values change? No. The value of personal choice was still there, but now your personal choice is impacting my health. That was the change. And the value, health is a very personal thing. So as soon as it twisted that your personal choice was negating my health, that's what changed overnight. So I think recognize that the values of personal choice, and you can do whatever you want to because it's your life, those haven't changed, but how can we tie to those other values in order to move the movement forward?
Okay.
Terry Allen with the Population Health Roundtable and NACHO and from Cobb County, Cleveland. I just wanted to sort of make a statement first, brief, to follow up on what Winston said, and that I think it's important to understand collectively the story and the narrative around issues of the isms. In Cleveland, one of our health improvement plan central themes that emerged from talking with community groups was this issue around eliminating racism as a social determinant of health, which sounds like a huge issue, but that term then requires a lot of dialogue and discussion with people, a lot of emotion, a lot, and so it's important for me, and I think where Winston was coming from, to begin to understand the best way to gain traction and reach, and whether we have to start there. It is important to start there, and I think for me that will be something we need to revisit and understand. Changing gears, I guess from Ray's perspective and the movement around walking, and he is, I think, at a stage where you consciously are moving toward this idea of a national movement. Kaiser in a sort of a submerged leadership role. If you can talk a little bit about how you see the next steps going forward to try to create what you hope to be a national movement, where you are in the continuum, and what you think are maybe some pivotal points in the discussion of what seems like a elegant its simplicity, this 30 minutes a day sort of thing. So.
Well, I was hoping I'd get some advice on that in the course of today, because we really are in the early phases here, and we really are trying to learn both from the experiences of the people who are involved in it and from colleagues like all of you. I think you are correct in identifying the fact that we've really submerged our brand and our involvement in this in the interest of really having distributed leadership and a broad-based partnership of people who come at this from many, many different directions. At the same time, we've been a very important funder to get things started, and we've put a lot of our leadership's time into promoting it and supporting it and so forth. And we're at a point where we need to decide what's our next step. How do we support the movement maturing and do it in a way that brings still others into leadership and other sources of funding? What's our role in the future? So there's a lot of self-reflection going on right now, and it's delicate because you don't want to. It sounds easy to say, step back, others will fill it, but you get a little nervous if you step back. Will it continue? Is it the right time? And so forth. So I think that's one part of it. I think that the second is around this issue of relationships. We've invested a certain amount at this point in the social approach to this, engaging people in their social networks and getting them to engage their social networks in the work and in the cause and so forth, and that seems to be getting some traction. We need to now, I think through very deliberately what is our strategy to really build relationships among all the people who are part of this and want to be part of that in a way that's really sustaining. So it draws on much, I think, of what was said earlier today, which is how do we pay attention to the people who are involved in it and their roles and their relationships. And I think we're going to need to pay more attention to that. The third, I think, is to figure out what going forward is the way in which this national group of organizations, what is its proper role with respect to on-the-ground organizations that are really promoting and pushing change at the local level, so that it's, you hear people talking about the changes that are happening in cities and towns all around the country. That's not because of the Everybody Walk steering group and coalition. That's work that we want to encourage and promote and harness. So what is the appropriate role of that group that have come together at this point versus what happens on the ground? So no great answers there. Those are some of the questions that are ahead of us at this point.
I think we have some questions from the web.
Yes. The first question is, what are the roles of state health departments versus national health units like the Institute of Medicine? Can state governors be drafted as a group to help educate the public on health equity issues?
Okay. Joan, you want to start with that?
I think there is a role. I think Mary mentioned earlier the Office of Health Equity in the state of California, so that will be one definitely to watch. But I think it's also sort of how it implements across, and it isn't seen as just something that one office in one department or one agency does. How do you get that philosophy shared? And the Strategic Growth Council is perhaps one cross-cutting way to do that. That's another initiative underway in California. But I think states need to think about how they can support, but then get out of the way in terms of some of these community-driven approaches.
So I think that my answer would say it depends on who the governor is. I know that sounds shallow, but I lived through a Republican and a Democratic governor in Colorado in the chief medical officer position. And if you read the Health Disparities report, which was funded by Robert Woods Johnson in our Turning Point grant, the first one under the Republican and the second one under a Democrat, you see this radical change. So we couldn't use words like racism or environmental justice or any great or I think we even steered away from health inequities. The data were the same. It was exactly the same data, but the words were all different, and we could use all those words when the ideology of the governor's office changed. So it really is, you kind of maintain the movement in spite of the prevailing political ideology, and then see how that can translate down to local health departments who might reflect their county commissioners. And so it's a really interesting area. You can facilitate, you can be a leader. These are all champions. My local health department partners were all champions for health equity, but it becomes difficult in the issue. Since racism came up twice, I'm sorry, I can't help myself now, so I'm answering the last question again. So Winston, it's an issue of, as far as I can tell, I like to think of it as an issue as timing. So Angela has convinced me that, she basically said, you're going to have to address it, and you're going to have to call it racism at some point. And the issue is, where is that tipping point? Because recognizing unconscious bias and personal racism, that's a personal journey that it's really hard to think about how we can affect that, because it's a little bit different for every person. Because recognize it's not just you, right? It's your parents and your grandparents and your community and your country that you have to deal with in that personal journey. And I don't have the answer, except Angela tells me eventually we're going to have to address it.
So I also have to speak on it. Let me give you an example, a story. Many years ago, many of you, I'm sure, are all probably familiar with the Joint Centers Place Matters initiative. So I was a part of the initial launch as a TA provider, and we were all assigned sites. And I was assigned to a site in Alameda County, in Fresno, and in Seattle-King County. Now, this is way back. In Seattle-King County, I went out there a couple of times to help them figure out their vision and how to operationalize their vision. And I was told that once they settled, they wanted to have their vision be eliminating racism. That they wanted racism to be their main area of focus. And as a consultant, you don't want to support the group that you're working with, but I kept trying to figure out, okay, now how are we going to measure this? What's the evidence? How are we going to make this happen? Fast forward, what they were able to do, in their own words, years later, they have the most powerful, in my opinion, public health department that focuses on issues of racial equity, but they had to just change the focus from eliminating racism and use a frame around a racial and social justice initiative. And that way they were able to get the entire public health department to buy into the idea. You were able to have much more inclusion, and you're still getting your issues addressed. The key is, how do you create the sense that people can feel like they're a part of this process working with you, rather than saying that it's going to be racism. But when you focus on racial justice and equity, you have the better opportunity. So I just wanted to say, and we are doing at PoliThink a major broad set of research around public health departments across the country and how they're institutionalizing health equity. And there's a lot that I can share with you. This isn't the time to do it, but we have a major set of research underway. And again, when we start to rank, I can tell you offline which public health departments are more effective, and they all have issues around racial equity, but they had to just temper the language a little bit around the racism piece.
I want to check and see if there's another question from the web that we wanted to take before we're going to have to be, I think, very quick to take George and Jeff's last questions, and then we'll have to move to the commissary for lunch. So why don't we try to wrap up in the next 5 minutes?
I'll try to be direct. This is George Isham, Health Partners Minnesota, and also the co-chair of the Population Health Improvement Roundtable. Joan Twiss, you talked about the fact that one needs, in order to be successful in the Healthy Cities movement, you need to work across political parties and across administrations. I think you said something very close to that. I hope I'm accurate.
Yeah.
And yet, already from this panel, your neighbor Ned over there has already clearly revealed his perspective along that boundary. And thirdly, it occurs to me that the political parties themselves, both of them, have hundreds of millions and now billions of dollars where they're trying to shape attitudes of the population and actually divide their issues such that they garner a larger share of the population. So, and they're pretty evenly matched at this point, to the detriment actually of the country overall, because it's hard to build a consensus across that. And so the second part of my question is what Ray said, is that you need to focus on values, because I think you also mentioned this political issue in your wife. Well, what are the values for population health, and how do you get to them?
Well, it's interesting. There were many aspects of what you said, and I know we're short on time. I don't think what Ned and I said was all that different. You do have to find the windows of opportunity with different administrations. I think we've lived through about 5, I don't know, I'd have to actually count. We've been below the radar. We have not been well resourced at all. And so there's pros and cons to doing it. And are you taking the longer term vision, or are you taking, let's have a big spread with one particular individual? You do run the risk when that person is out of office. And you have to make sure that your values are aligned with that person. But I think what was said about the core values of humanity are really interesting. One of the things that we got in the first 2 years, maybe even a year and a half, was a resolution out of the legislature in California supporting healthy cities. We had the most extreme conservatives and the most extreme liberals. And the lobbyists came back and said, I've never had this set of 6 or 7 people on the same resolution. Now, it's a resolution. It's not funding. It's not changing the way government did business. So you can only take that so far, and I get it. But I think if you get to the point where you're talking about core human values and getting to those, and really addressing them, and I think the interests are sort of where those things kind of start to diverge, and how people get their information and how their language and viewpoint is shaped, we know, by certain media outlets, etc. So it's kind of, there's an awful lot of complexity. And I don't know if I didn't quite answer what your question was, please.
So George, I just have to add, the Office of Health Disparities was actually created under the Republican governor. So you got to recognize that we found the core, the shared values, and just like only Nixon could go to China, only a Republican could create the Office of Health Disparities.
Thanks.
Okay, quick question, Jeff?
Sure. It's actually just a quick comment. Jeff Levy from Trust for America's Health and Population Roundtable, but also a former member of the Equity Roundtable. And I just want to second what Mildred said about being careful about choice of language and being conscious about choice of language. And there have been a number of references to the gay marriage effort. And if you actually look at when the tide started to turn, it turned when we stopped talking about being anti-gay marriage as being homophobic, and it started to be presented as freedom to marry and marriage equality. The same a better outcome, actually, a successful outcome, and a reframing that got the issue in touch with shared values rather than necessarily challenging something that, as Ned pointed out, can be so difficult to overcome in a very short period of time.
Thanks, Jeff. Really good example. And I think it also lifts up the point that Ray made, and I also learned in working in AIDS in the very early days, and that is that you have to open up the circle to allow people who may be coming in from different points of view. And if you frame it too narrowly, you're going to shut off their opportunity to contribute and be part of your movement. So with
Mary,
that,
can I
I'm
just comment
go
on
ahead.
that, just really briefly.
Go.
That just to say that I'm astounded at how we've forgotten what was happening in the 1980s and 1990s around AIDS and what we learned about what works. Yeah. And I noticed in one of the background materials for today, there was a reference to as a problem. I read it as a problem that there was tension between activists and scientists. Yeah, there was, but you had ACT UP and NIH sitting down together in the same room figuring out how to accelerate vaccine research and other kinds of things going on. And I view that as a great moment rather than a problem. So I do think going back to what we learned about how you can create great change in those times is really important to do.
I agree. All right, it is 12:21. We have to begin again promptly
Let's reconvene at 1:15.
Okay.
Give ourselves a little flexibility for networking and
Great.
maybe a little
Thank
walking.
Take a walk.
All right, we'll reconvene at 1:15. Lunch is in the commissary. Thank you, everyone.
Yes, I agree, I did it.